Thank you for joining our monthly GDDS visualization tool user group for the GHA user group. We have from GHA, we have Sharif Navos, Bill Wiley, and Stephanie Taylor. So we thank you for joining us this morning. We have a pretty robust agenda here talking about the data release for 2020, the limited data set. We have some new member reports to discuss, and also COVID-19 data monitoring. And then, as always, this is an open forum for your questions. And again, this meeting is intended for you, the users, and we ask that you please speak up and use the text box or unmute yourself and ask any questions. We are recording this, and it will be posted on the GHA website in the data services section. And we do ask that you keep yourself on mute while we're presenting, but please unmute yourself at any time and ask questions. If you have a Zoom camera on your laptop and you'd like to show your video, we'd welcome that. We'd love to see your face. But otherwise, we will get started. As always, I'd like to give just a quick overview of what the Georgia Discharge Data System looks like. We have hospitals that submit to HIDE, our vendor, in the UB04 format. HIDE is our vendor. They are part of the Missouri Hospital Association. They're our vendor, and that meets the state mandated requirement for hospitals to submit their inpatient and outpatient data. That data is processed and then becomes the Georgia Discharge Data System. It is then, given to GHA, and we, on your behalf, submit that to the Brain and Spinal Trust Fund Commission, the state of Georgia, the Agency for Healthcare Research and Quality, and the Healthcare Cost and Utilization Project. The HCUP is the acronym, is the organization that we use to fulfill any research requests that are made. They vet those requests and manage the data use agreement. And we vet those as well with our legal department here internally, so know that your data is being protected and used for the correct purpose. This is our schedule. I know it's kind of small, but this is our schedule of how the data is processed and when it is released. And at this time, I'd like to pass it off to Sharif Navos to talk to us about updating, keeping us up to date on your EMR vendor.
Thank you, Leslie. Good morning, everyone. As Leslie stated, we want to be updated on your EMR, so your electronic health record or electronic medical record vendor, whether it's Epic, Cerner, McKesson, and there's a few more. And I know that some of you have had updates this year. You change vendors, and this actually sometimes causes us to receive more data, whether it's because the old vendor wasn't capturing all of the data or wasn't, it wasn't mapped correctly for you to be able to pull all of your encounters, especially outpatient encounters. And I've noticed that. And so we like to keep our list updated to, one, be able to help you if you ever have any issues with your data, and also connect you with other facilities that share the same vendor as you. And then you can connect with them, contact them, and see if you can come to a solution, or if they've had that issue, they can help you and guide you in the right direction. So I think the last time we updated, we did a major update in 2018. And so I'm sure things have changed since then. And some of you have kept me updated, so I do appreciate that, by emailing me or calling me, or just letting me know if I notice any volume or distribution issues. You'll be like, oh yeah, well, we changed our EMR, and this way I can notate it too, so that others can see that, okay, there was an issue, or that it wasn't really an issue, is that their EMR has been updated and their data is actually more valid or more viable. And so please feel free to email me, contact me, and let me know which vendor you're using. Go to the next slide. And also we've been reviewing our quarter one database, and we've noticed that there are several payer codes that were being used by your facilities that were invalid, meaning they weren't, payer codes that are part of the UB04 layout. And this layout is what we use for this particular data. And so on page 7 of the layout, you'll be able to see the payer codes that are accepted. And so you'll see this week and in the coming weeks that I'll be contacting you to address these issues so that you can make corrections and resubmit your Q1 data with the correct payer codes. You can contact your coding or billing department also and provide them with that UB04 layout. I have on the right there of this slide, you can see a little snippet of that page 7. And if you need a copy also, please feel free to email me and I can email that to you.
Great, thank you, Sharifa.
Oh, sorry.
Any questions for Sharifa?
This is Mike from Augusta. In addition to the EMR survey, can we also ask what the billing system is that's being used?
Yes, that would be great. We'll do that. Thank you, Mike. And I failed to recognize one of our other GHA staff, Samantha Dulworth, is also on the call with us. So sorry about that, Samantha.
Hi, everyone.
Next, I wanted to just bring to your attention that we have released the quarter 2 2020 data set. I distributed the links for those that subscribe to the limited data set yesterday, and I wanted to make note that there are new COVID tables included. Heidi, our vendor, just kind of as an added convenience, created these COVID tables for outpatient, for inpatient, and for ER. And they just contain the facility ID, the D key, and a flag that says yes if the patient is COVID. So you would have to link that back to the patient record table in order to identify those patients. And of course, you can do that by diagnosis code as well. Those flags were created using the U071 2019 NCOV acute respiratory disease diagnosis code, and that's how those patients are flagged. And then we also have, that data is being incorporated into the GHA GDDS visualization tool, and that should be live and published by mid-September. Any questions about the quarter 2 2020 data? Okay. Sharifa? You're on mute.
Sorry, thank you. And this is in regards to our communications. A lot of you have, well, a few of you have contacted me to let me know that you're not receiving some of our emails. So emails for this user group meeting or any other meetings related to data. Also, our COVID-19 updates, which are sent every day, and other weekly mailings that we send from GHA. And if you have noticed that you were receiving them and you're not receiving them anymore, or you're not getting, somebody has to forward that to you, you're not getting those, and you're a user of any of our strategic planning tool or HeidiNet data upload tool, please let me know. And also we'll put a PDF on our site that shows you how you can let your IT department know to add us as a trusted sender. This is a snippet of that PDF, and we'll post it on the resources section of our data page, where you can download that and just forward it to your IT department, because a lot of facilities, which I understand have firewalls and different things to stop, spam and phishing and all these, to make sure that their security is up to date, because there's a lot of that going on with, having to secure data and medical records. But we also want to make sure that GHA is on your trusted list. And so if you could read through that, send it to your IT department, and they should be able to follow the instructions and know what to do to add us, so that when you receive mass emails from us, or any type of communication related to meetings and updates, you'll be able to receive them. So feel free to do that, and that's on our website. Any questions about that? So
Thank you, Sharifa. And that was a great lead-in, because we did just release a number of new data modeling for the proposed rules and things that have come down. This seems to be proposed rule and final rule season. We get a bunch of them in the February, March timeframe, and we get a bunch in the August, September timeframe as well. So we just released last week, or actually this week, on Monday, a number of different reports that are in the finance folder. The Critical Access and Small Rural Hospital Data Book, that's a good comparison of some key performance metrics and some key operational metrics for all of the small and rural hospitals. It has expanded. It was just the critical access hospitals, but now CMS is making some other data available, so we're able to do small and rural. And then you can see we have a number of proposed rules that would begin calendar year of 2021, being home health, outpatient PPS, and I think that's it. And then we also have some PPS final rules that would go in with the fiscal year: inpatient, psych, rehab, and skilled nursing. There's a detailed explanation for each one of the policies. We call it just the policy brief that's in there. One thing I did want to mention with respect to the skilled nursing facility, we do know that there are a number of hospitals that have skilled nursing facilities that did not receive a report, and that was done because of the way CMS is actually releasing data. We work with the Hospital Association of New York State to do a lot of these modeling, and in the past they were able to release some calculated reimbursement to actually demonstrate the impact of the new rule, and CMS has not released that data in that same format for the 2020 rules, and so it's resulted in probably 10 or 12 hospitals in Georgia that have skilled nursing that were not showing up in the rules this time. So we'll get that hopefully corrected as soon as CMS will update their data. Lastly, we did release a number that we put in the quote quality folder, including the value-based purchasing analysis for critical access hospitals. That's based on Q2 of 2020. That's federal fiscal year Q2 of 2020, so which would go into effect for 2021. And then for the full membership, the value-based purchasing analysis. Going back to that first one, there is the wage reclassification analysis that was on there. Normally you have until, I think it was September the 9th to do any sort of comments or trying for the reclassification. That's been put off because of COVID until after the IPPS rule is done. That's actually a really good one, because what it allows you to do, it's done as an Excel file, not a PDF. You can actually go in and do a drop-down menu to compare your CBSA with others that you would potentially reclassify to. So it would give you kind of a model on what it would look like if you stayed in your home CBSA or moved to another one. So it's a good one. And like I said, it's you got a little extra time on making any of those applications to your MAC. So any questions on the member reports?
We do
Does
have.
everybody go ahead, Leslie.
We do have a question in the chat box. Somebody that's newer to the Georgia data, but is there any discussion in having ASCs share their data?
We'd love to. This is a state mandate, though, for hospitals, and unfortunately, AmSurg centers are not under the same requirements. And as much as we'd ask, they have not had any indication of sharing as a group. So unfortunately, we don't have that, or we don't have independent physician practice data. But if there was a way to get it, we'd love to incorporate it.
Any other questions? just quickly, if you're not familiar with how to access the member reports, you just simply go to the GHA.org website and log in or sign up. Anybody can create an account on the GHA.org website, which contains a wealth of information and links and education opportunities. But specifically for this, you will log in, and there is a retrieve password if you've forgotten your password. You want to go to the data tab and click on the Georgia Discharge Data System, and that will take you to an area where you can click on member reports. Sharifa mentioned also that we'll be posting some things under the Data Services Resources tab. That's where any forms or authorization forms or I think the recording links are posted there as well. UB04 layout, reporting tools are listed in that resources tab. But for the member reports, you would click that button, and then this is showing all the hospitals, but you would only see your facility or facilities in your system. And if you have questions about gaining access to that, just contact Sharifa and she'll be glad to help you. Typically, Bill, who have we given access to?
Any C-level is automatically granted access, and then anyone else that the hospital has deemed. So really all you need to do is just email us to ask, have your CFO or CEO just forward an email saying, hey, that's good, go ahead and include them. There's nothing in there from a PHI standpoint, so we don't have to worry about anybody with any sort of HIPAA. It's more for sensitive data. There are quality measures that are reported in the quality ones. The modeling can show positive or negative financial trends. So that's the only reason we limit. I do think we granted all of marketing access because this is where the annual economic impact report is posted. And it seemed like marketing and PR were the ones that were consistently asking for that. Let me just, while we're on the screen, let me go ahead and just talk through how the folders are set up, because I think we do have some questions on that. They are broken down by either individual hospital, or if they're a system, we have different folders underneath a system tab. So some reports we're able to run at the full system level, and then some are run at the individual hospital level. So if we were to click through, Wellstar would have 11 hospitals underneath. They would also have a system folder. And each one of those folders is actually organized in the exact same way. There's the economic impact. There is the finance folder, the policy folder, and the quality folder. Sharifa, didn't we even add a COVID folder, or did we just put those COVID reports in finance for any of the CARES Act funding when we get some of that modeling? So if you don't,
we put it in finance, but we can always create a COVID folder
if we got more. Yep, that's fine. I couldn't remember where we put those initial CARES Act.
Oh no, it's under a CARES Act folder.
It is under CARES Act. Okay, we didn't do CARES Act. That's right. I'm sorry. So if you don't see a report in one particular folder, check and see if it's underneath the hospital. If we do have the ability to aggregate them up to the system, we have done that. For the purposes of a system, unless we've had a CEO or someone ask just to be limited to one particular hospital, they're granted all of them. So anyone that has access to a system usually has access to all of the hospital reports underneath that as well. If not, let us know. There are some unique system arrangements where there may not be completely owned by but managed. So we've tried to take into account all of those different scenarios, but sometimes we will miss, or our back-end system only recognizes you at one hospital, not the other, even though there's a management relationship there. So if you have any questions on that, email Sharifa for access, or me. When we send them out, we tend to get a lot that have request access to either one of us. So that's fine to request from either one of us.
Great.
And
Thank you very much.
I'd like to add to under the data services resources, what I was referring to earlier is named GHA mailing list unblocked 2020. And then there's also the new point of origin G that we discussed during the last user group meeting. So if you are new to that, that's also there for you to revise. And, these are changes that occurred due to COVID. So anything that of that matter will be put under that data, that resources tab, which is located in the same place.
And while we're talking about that, if you're new, or even if you would just like a refresher, kind of an update or training for any of our tools, for the visualization tool, for the readmission tool, for a refresher on what reports you have access to, our resources, please let us know. We'll be happy to schedule a 15 to 30 minute quick refresher course for you or your team. Sharif and I are happy to do that at any time. So please reach out to us and let us know how we can support you. The next section, Stephanie Taylor, who's with us, helped develop these beautiful reports. And Bill's just going to give us a quick update about what our volumes are looking like, especially as it relates during this COVID-19 time.
Thanks again, Leslie. Yeah, one of the things that we were monitoring, and we knew this was occurring, and I think we talked about this at one of our earlier ones, just the impact that COVID had on the first quarter. Anecdotally, we were hearing that hospitals said volumes were bouncing back in Q2. Honestly, Q1 was on pace to be a really high encounter quarter until the last week of March. So it really wasn't, but the last 2 weeks of March, and it caused them to drop about 7% overall. And you can see down at the bottom, that's the total hospital and COVID PUI patients in the hospital. So you can see we had our spike in kind of late April, March, or a May time frame, and then it kept going, and then we saw that slow rise, and we've seen a steady decline for the last couple of weeks. This is through the end of June data, so we have seen, or I'm sorry, that's all the way through August. So we've seen a steady decline for the last couple of weeks. So hopefully that can stay on pace. The next slide will show you kind of how the volume really has looked, though. You can see that deep V, and unfortunately it did start looking like it was tailing off a little bit at the end of June. So we are not back to where we were in the beginning of Q1. I know a lot of folks have said volumes are back and this, that, and the other, but I'm wondering if that's just based on how low it really got at that low point in kind of the middle part of April. Started to tick back up in March, really kind of the second week of March, but you can see how that graph and that trend didn't really continue back. So we're definitely not back to January, February volumes. You can see in some of the individual patient count by admission types where some of that has come back. The emergency room has been a huge driver of admissions as normal, and then you've seen some of the urgent care and electives. Individual service lines, you've actually seen some that have increased pretty significantly. Let me see if I can expand that a little bit so I can see for you and talk. As expected, pulmonary medicine has come back up. Cardiology, luckily, has bounced back to a lot of a significant extent. These were some of the ones that we were worried that require early intervention. And we were not seeing it. So, the cardiologies, the oncologies, places like that. I guess the good news is those have rebounded from kind of the lows. So we're kind of back where we were expecting there. That's on the inpatient side. On the outpatient side, which is I believe the next slide, we are still way down. So that kind of told us what we were expecting. That people are still putting off services, especially the outpatient. The inpatient is, that's not elective. Those are people that had to be there. But the outpatient, where folks are kind of choosing whether or not to go, we are still significantly down from January and February and even into March. So the encounters are still, we're still hoping those will start ticking up so we can get it back to normal. These are all measures that you can run on JVION. This is not anything that we've had other data sources for. So this is, you will be able to run all of the same information if you needed to run a comparison report for your facilities. But wish we had better news that everything was back to normal. It was a pure V and an immediate bounce back, but looks like it's going to be a little bit more of a slow burn to get folks back to where it was beforehand.
Thank you, Bill.
Leslie.
Any questions? Not just as it relates to the previous slides, but do you have any questions, any discussion topics? Is there anything we can do to help support you?
This is Trey Meyer with CHI Memorial in Northwest Georgia. Just a quick question. I've been meaning to ask you all this, and since we just discussed it, it just came back to mind. Do you all have a specific list of diagnosis codes that you are using to define COVID cases that we can then use in the JVION platform?
Yes. Let me go back up. This is the code right here, the U071.
Okay. I just overlooked that. Okay. U071.
It doesn't
Okay.
have to be the primary either. It can be any diagnosis code. I mean, it can be any, you know, it doesn't have to be the primary. It can be the secondary, tertiary, whatever.
Got it. Okay. Thank you very much.
You're welcome. Thank you for the question. Anyone else? The slides will be available in a PDF format. Sharifa posts those after the recording is available in that member or data resources section on the GHA website. If you need help getting to that, just give us a call, let us know. But usually, probably by the end of the week, it'll be posted. Correct, Sharifa?
Correct, yes.
Great. Anyone else? Well, not hearing any more questions, I don't want to just keep you here in silence. Our next user group will be October the 7th, and I'll go ahead and for the next user group put the 2021 schedule out. Our meeting is the first Wednesday of each month, unless it falls on a holiday or right before a holiday, and sometimes we'll postpone or move those. But we really appreciate your time, and again, please use us as a resource for anything we can help you with, whether it's you know, familiarizing you with the tools that are available. We'll be happy to do that. If you have new staff, even if you have a new CEO or C-level person that isn't familiar with the GHA data programs, you know, please let them know that we're here to, you know, get them up to date and get them in touch with what data sources that we have. So with any last call for questions. Well, hearing none, everyone have a wonderful afternoon. Happy Labor Day, and stay safe and wear your mask. Thank you.